Welcome to our channel. I'm Fafa Andrew, and today I want us to talk about hepatitis A. Now, this is your channel where you can find all the information you need about your health. So all you need to do is to subscribe to our channel by clicking that red subscription button, like and share this video with the people you care about. Also, if you have a question that you want me to answer, or you have a topic that you want me to talk about next time, please leave your suggestion in the comment section. And if you have a pressing issue that you like to talk with me personally, I have a WhatsApp number on the screen there. Please contact me and we shall talk. Let's begin. Hepatitis A is a liver disease which is caused by hepatitis A virus, and it leads to inflammation of the liver, and it is transmitted from one person to another through ingestion of food or water which has been contaminated by feces of someone who is having hepatitis A virus. Who is at risk of getting hepatitis A? Everybody is at risk of getting hepatitis A, but there are some people who have a high risk. For example, people who have poor personal hygiene, like people who eat without washing their hands, people who don't wash their hands after using the toilets, after changing the baby's diapers, before preparing food, and people also who eat raw fruits and vegetables without washing them are people who are at risk of getting hepatitis A virus. It is also common in low to middle economic status countries, and I believe that is where most of the African countries lie. Now let's look at the signs and symptoms of hepatitis A. In most cases, you may be asymptomatic. That means you may not have any sign or symptom. Or you can be symptomatic. That means you may have signs and symptoms like general body weakness, feeling of low-grade fever, abdominal pain, which is located in the right upper part of the abdomen, here where your liver is located. And then you may also have problems with defecation. That means you may have diarrhea or constipation. You may have other signs like itching of the skin, and then yellowing of the eyes, and then you may also urinate very dark urine. Now, some signs like urinating of dark urine and yellowing of the eyes comes about because when you ingest the food or water which is contaminated by hepatitis A virus, the virus goes to the small intestines, and then it is absorbed into your blood, and the blood transports it to your liver, and the liver, it damages your liver and it gets inflamed. So it fails to perform its function, and as a result, there is accumulation of some chemicals like bilirubin, which leads to itching of the skin and yellowing of the eyes. So those are some of the signs and symptoms of hepatitis A virus. Now, let's see, how can you test for hepatitis A virus? Now, when we suspect that you have hepatitis A virus, first of all, we do history taking. That means we ask you about how you're feeling, and then after that we take some blood samples and we test for the presence of the antibodies against hepatitis A, or we can also test for the DNA of the virus itself. Now let's look at the treatment of hepatitis A. Now, hepatitis A does not have a specific treatment, and most people recover without any treatment. Now, when you have hepatitis A and you don't have serious signs and symptoms, we can advise you to take a lot of fluids and then to have enough bed rest. But if you have serious signs, we also treat those signs. For example, vomiting, we may treat with drugs which stop vomiting, and diarrhea, we may treat with drugs which stop diarrhea. And then some people may also have acute liver failure due to hepatitis A, so they may need hospitalization. Now let's look at the preventive measures of hepatitis A. Now the best way of preventing hepatitis A is just by simply improving your personal hygiene. For example, washing your hands after using the toilet, in the baby's diapers, before preparing food, before touching the utensils, also washing the fresh fruits and the vegetables before eating is also advisable. And then you can also prevent yourself from getting hepatitis A by avoiding eating from places with poor hygiene. Also, people who are traveling to areas where hepatitis A is high, they are advised to get a vaccine for hepatitis A. So that is all I had for today, and if you found this video important, I request that you consider subscribing to our channel, like and share this video with the people you care about. God bless you. See you.